How about somebody with a nose that's humped, a hump nose when you look at the side? It goes out like that.
That's called a dorsal hump. And that's this cartilaginous portion, okay? The middle portion has cartilage, but it also has some bone, all right? When someone has a hump, they'll have actually a little bit of that bony hump, and they can have also a little bit of that cartilage hump. And you have to basically take that down, or you have to rasp that bone, and you have to basically resect or cut out a little bit of that cartilage.
Where do you take it off? You make an incision out here, you take it off from the inside? What do you do?
Yeah, I approach the nose what's called an open rhinoplasty, which means a small little incision right here, what's called the columella. And you basically will then
pull
the skin back from the nose and
then operate on that field there.
Operate on it there.
Do you pull that little cartilage out of that groove, or you leave it in there and you just shave off some of the upper part when you're doing open rhinoplasty? I like that word.
You have to take what's called an incremental approach, meaning you shave off a little bit of the cartilage, redrape the skin back over, and you feel. You have to make sure that you're feeling and making sure that you're not over-resecting that cartilage. If you over-resect that cartilage, it can actually cause the person more problems than that hump did.
So you have to be really, really careful that you don't get too overzealous.
Correct.
Frequently, what happens? If you take your time and you do a good job, everything's fine, or sometimes you got to go back another time.
More often than not, it's going to be, especially if you take an incremental approach, meaning like we just talked about, rasping a little bit of a trim, don't have to go back.